Hello everybody. Hello. Just wait a little bit of time for more people to come in so that I can get started. We're going to have a very awesome video day today. So be prepared. Alright, so I'm going to head and get started. This time I'm going to do this live feed a little bit differently. Hey, hi Eric. Good afternoon. Afternoon. Alright, so today I'm going to be covering 5 most common things that I see in the chiropractic clinic, and I'm going to be going over them in detail, how chiropractic can help, and what to do and what to expect. Alright, so the 5 topics that I'm going to be covering today are going to be neck pain, low back pain, scoliosis, frozen shoulder, and slip disc. These are some of the most common things that I tend to see in the clinic. Now, the first one I'm going to tackle is neck pain. Alright. Now, first and foremost, not everybody is a chiropractor. Not everybody knows what chiropractic is and what it does. Hello, Quaid. Good afternoon. Hi, Wayne. It's good to see you. Alright, so the first thing I'm going to talk about is what is chiropractic. Now, chiropractic is not what a lot of people think. It's not like just, whack them and crack them, crack the neck, crack the bones, things like that. It's a lot more complicated than that. Chiropractic is a profession that focuses on the bones and the joints of the body, but mainly the spine. We are not medical doctors, and we do not treat medical conditions. So if you go to a chiropractor and you say, well, I have this, I have a migraine headache, or I have tinnitus, that's awesome. We understand that you have a concern and a problem that needs to be dealt with, but that is not what we're going to be tackling. The reason why I say this is because the reason why we focus mostly on the spine is because it surrounds and protects the most important organ you have in the body, the central nervous system. As you can see, this picture that I have right here behind me, it shows the brain and the spinal cord, and it shows all the nerves that innervate all the tissues, the organs, and cells in the body. Hello, Alex. What's going on all the way in the States, man? Good times. Anyways, we focus on that because we're directly affecting the central nervous system, so everything is involved. So if a person comes in with high blood pressure, we know that it can be an upper cervical issue, it can be an upper back issue. That's why we tend to check the spine and see what is going on, to see if there is a connection. Now, there was a research article that was done in 2007 that showed that one chiropractic adjustment is the equivalent of 2 of the highest grade high blood pressure medications given combination. That means that the people who were receiving chiropractic care, their blood pressure dropped down 16 to 18 millimeters per mercury. Now, does that mean chiropractic care corrects or heals high blood pressure? No, it does not. The central nervous system is what regulates everything. The body has the ability to heal itself, but needs no interference. That right there is how chiropractic helps a lot of people. We remove misalignments by aligning the spine so that it can properly heal. Chiropractic is not about getting people to instantly feel better, but to heal the right way. It's about that right there. That is the main thing that people need to understand. Now, the chiropractic adjustment can be addictive. It feels good. You feel sleepy. You're able to sleep better than when you have misalignments constantly bothering you, that's constantly causing interference. So what a chiropractor does is an awesome thing. It taps into what you already have the ability to do. Doctors do not heal anything. Your body does. Now, I'm going to go into the first subject, which is neck pain. I'm going to cover it in great detail. And if you have any questions about anything that we're talking about, whether it be on the list of the 5 most common conditions or not, I am here to answer those questions. Okay? Now, neck pain. What is neck pain? Neck pain means that there is a symptom that is taking place within your neck that is causing you any kind of uneasiness. It doesn't feel comfortable. It doesn't feel normal. Now, what can cause neck pain? It can be a plethora or many reasons why. The first most common cause of neck pain is a cervical misalignment. That means whether it be C1 through C7 might be out of its normal position, causing an increased pressure on the nerve, and that right there can cause symptoms of neck pain. It can be because of poor posture. Now, one of the most important things I need to elaborate is there are many causes of misalignments. One of the biggest things that I see with patients that come into the clinic is poor posture. Slouching, going like this, sitting back on a chair trying to be cool. All these different things cause increased neck pressure, okay? Now, your head is the weight of a bowling ball. That's about 12 to 16 pounds. See, in kilograms. I don't know what that is in kilograms, but it's pretty heavy. And the weight of the head kind of falls down. So as your neck is curved and the head is over here, the neck begins to go straight. So all the muscles are basically contracting. What that means is the muscles begin to fatigue. Now, as the weight is pushed onto the joints, it becomes inflamed. It is what you call arthritis. Arthritis is nothing more than increased inflammation in the joint. Not increase. It's inflammation of the joint. Plain and simple. Hello, Ivy. What's going on? So what I do for patients who come into the clinic who have, say, neck pain are many different things. One of the most important things that I recommend is cold compression. Not every chiropractor recommends cold compression. Some chiropractors do, some do not. And here's the reason why I recommend cold compression. The cold compression reduces the inflammation in the joint. Let's see, hold on. You're funny, man. Yes, Alex. The doc with the black belt. I miss you too, man. I miss you too. Alright, so the cold compression causes vasoconstriction, which means the arteries and the capillaries begin to get smaller. And that right there reduces pressure. So the fluid that's within the joint is able to move much easier, which helps reduce the pressure on the pain-sensitive structures. And that helps with the healing process. It doesn't heal it, but it helps with the healing process. Now, the other thing that I tend to do for patients who have this condition is I do a basic chiropractic adjustment. For us, it's basic, but for anything else, it is not. Because why? It's motion that is induced into a joint that is not moving properly due to years of wear and tear. Now, once you get motion into these joints, the body begins to heal, and the cold compression makes it much easier. Now, there's other things that I do with a patient who has neck pain, but the biggest thing that I do is I look at the body as a whole, because everything is connected. So when we treat the neck, we're getting motion into it, the body begins to heal. Everything takes time. Everybody has a healing process that is different. No two people are the same. Neck pain can lead towards other complications. Neck pain can lead towards headaches. It can lead towards increased blood pressure. It can lead to ringing in the ears. There are so many things that neck pain can cause. Now, do any of you have any question whatsoever concerning neck pain? Because if you don't have any question concerning neck pain, I will begin to go to the other condition that I tend to see most commonly in the clinic. All right, I'm gonna wait a couple seconds. Oh wow, we're getting a lot. Robert Bailey, hey, how you doing, brother? I need you to come to Boracay. Yes, I love Boracay. One of these days I'll go there again. Last time I was there was December for the New Year's. Love that place. I've only been there twice. Yes. So neck pain can be a very problematic issue. So chiropractic care is one of the best things that you can do to help reduce the amount of times you get neck pain and reduce the time that you have neck pain. Oh, another thing that leads to neck pain. How can I forget this? It's one of the most important things. Sleeping patterns. If you have poor sleeping patterns, meaning you lay on pillows that cause your head to raise up too high. Say you're laying on the side and your head is like this while you're sleeping, the pillow is too high. You need to reduce that. When you reduce that, it doesn't cause an imbalance in the muscles. Now, whenever you have poor posture when it comes to sleeping habits, there's things that, hi Rain, how you doing? There's certain things that affect your muscles. And is one of the things that I learned in college is called creep and hysteresis. What that means is the muscles are constantly contracted. So when you have one side of the muscles and ligaments and tendons contracting and the other side is not, meaning head leaning, you're going like this, you're contracting on this side right here, it means that once the ligaments are basically going to be too loose are going to be too tight. And then there's a specific amount of time for those muscles and ligaments to get to the normal length. And most of the time we spend hours in the same position, sitting down, laying down a certain way, and we do not correct this. And that's why a lot of times we will have stiff neck. And then that right there leads to other problems. So how you correct that is, for one, chiropractic care, best for all of that. Number two, have a pillow that is the right size and you lay on your side and face up, never face down. Hi Karen. So thin pillows are not good. Thick pillows are not good. You want to make sure your spine is neutral. This is one way how you can prevent neck pain, is by having proper sleeping habits. But the thing is, a lot of times when we're asleep, we're not in control. We're not in control of what we do when we sleep. So all we can do is just deal with it after. So if you wake up with a stiff neck, that is a form of neck pain. Just put hot compression for about 5 minutes and that will loosen up your muscles. And then go get yourself a chiropractic adjustment, and then that same day use cold compression. Everything is with cold compression. All right, so the next thing we're going to be talking about today on our 5 most common conditions that the chiropractor sees is low back pain. Now, low back pain can be caused by many things too. Again, it comes down to the two most common things: poor posture and stress, physical, chemical, and emotional stress. Stress causes the muscles to tighten up, and when you're in poor posture, you put a lot of induced pressure onto the joints, and the muscles adapt to that, and it puts pressure on the spine. On the spine, you have nerves that exit out. On the low back, they're bigger. So if you have muscles contracting on this side due to poor posture, say if we're always leaning to the side, hanging out like that, we're going to have an imbalance in the muscle. Now, these are things that I see with patients that come in. Either their lumbar spine or their sacrum or their hips are misaligned and the muscles are hypertrophied. What that means is the muscles are constricting and tight and they grow. It's like going to the gym, you exercise and your muscles get big. That right there is called hypertrophy. It can be good, it can be bad, depending on how strong and how long these muscles pull on the low back. Now, a chiropractor is the best person to address and find the true cause of the low back problem, the low back pain. Now, it tends to take a little bit of time for chiropractors to find the real reason. Now, once we find it, it's so easy to treat, but the hard part, this is the one thing that I should have mentioned before when I was talking about neck pain, is patterns. Every person creates a pattern. Hey, what's going on, Aris? How you doing? Patterns are the reason why most people's problems keep coming back. So it's very important to address the problem, the root cause, and then maintain that. Chiropractic is not just only for when you have symptoms, but it's also for maintenance, maintaining it so that it does not keep bothering you. Why? Because again, it goes right back to stress. Physical, chemical, and emotional stress. What's going on, Light? Yes. Hey, Doc Storm. How you doing, brother? So these patterns, in order for you to properly deal with it, is you have to change your poor habits. That means not sitting down for too long, movement, all the time moving, staying active, not having a stationary life. These things are very, very important. And once you figure out what the pattern is, then you have to figure out what it is that you're doing that is leading towards this pattern. Okay? That is key in anything that is treatable. Finding what the cause is. We don't know every single thing. We're not psychic. Only you know what your poor habits are, and it's up to you to change them. So low back pain is very easy to treat, and then maintaining it, that right there is up to you on how you want to deal with that. So a chiropractor will go in and adjust the bones that are needed to be adjusted, align them, and teach you exercises when it is necessary. Exercises are not always needed as soon as you get yourself adjusted. You have to figure out what your weakness is. Hi, Ronnie. What's going on? You have to find what the weakness is and then strengthen that out once the inflammation has subsided. If you have a misalignment pattern that creates any kind of dysfunction and you sit there and you go out there trying to exercise, then you're not going to get the results that you want because you're kind of defeating the purpose. And the reason why is because you have to strengthen core muscles, but only once things are not inflamed. And how do you deal with that? It is cold compression every single time. Cold compression is your best friend. Now, low back pain can lead towards other things. It can affect the muscles in the hips. It can affect everything above. The important thing to take from this is the body functions as one. You correct everything, and then you change the poor habits, you change the pattern, then you have a better outcome at the end. Okay? Now, can this low back pain and neck pain keep coming back? Yes, for as long as you have the pattern. Again, I'm going to emphasize maintenance is important. Okay? It's like, dentistry or going to the gym. You exercise and you get to a specific point when you go to the gym. You don't just stop, you maintain that, and that's what maintenance is important. And the other thing that can help with both of those conditions is stretching. If you stretch the muscles, it will reduce the tension on the joints. So the stretches would be the first thing that I would recommend before recommending exercises. Once it gets to the point that everything is stronger, the inflammation is reduced, then exercises can be implemented in your daily life. It can be as simple as doing planking for like 5 minutes, or doing some simple push-ups for 5 minutes. It can be many things that you can do once the muscle is loosened up and the joints are moving properly. Now, the next thing that I'm going to cover is scoliosis. Now, does anybody have any question on the two conditions that I've already covered? Neck pain and low back pain. Is there any questions? Okay, let's give it a second. See if anybody's going to ask any questions about those. All right, let's see here. I just want my neck and shoulder fixed. Yes, okay, so whenever you have a problem that's been consistent, regular chiropractic care is how you deal with that. Right now, we are currently in quarantine, modified quarantine, things like that. We have been locked down for about 3 months, so a lot of things are going to come out, especially when there's a lot of stress. So just go to the chiropractor, get yourself adjusted regularly, get yourself back on course, and you will be fine. All right, so I'm going to start covering scoliosis. This is our third subject on the most common conditions that I see in the clinic. We have 2 more after that. It will be frozen shoulder and slip disc. So scoliosis, what is scoliosis? Now, scoliosis is a very tricky condition that chiropractors tend to see very commonly. Now, scoliosis is the abnormal curvature of the spine that does not cause symptoms. It affects all of the organs because the information is not properly going back and forth. It is also cosmetic, but it is not something that causes pain. All right, now the causes of scoliosis, and I say this over and over to many people, is 1 is inborn, meaning you're born with it. 2, it is poor posture. Now, poor posture can cause scoliosis, how you're sitting, muscles getting tight, pulling on the bones and everything like that. Now, inborn tends to be a little bit more tricky when we're dealing with that. The only true way to properly diagnose that is through x-ray. Visually can be a little, it can be mystifying or give a false sense. On the x-ray, when it's inborn, what you're looking for is how the bones are. See, what chiropractors do, and I keep mentioning this, is get motion into the joint where it's not moving properly. And that right there is what causes postural abnormal curvature. And there are certain exercises that are implemented throughout the course of treatment. Now, a lot of it comes from core stabilizing exercises. A lot of it comes from what you're doing during the day. And that right there will give you a better outcome on how the curvature is addressed. So I have patients who have scoliosis who come into the clinic, and I see them twice a week, sometimes 3 times a week. And I'm seeing maybe like 1 to 2 degrees of change in the month, if not a fraction of 1 degree. the more severe a curvature is, the longer it takes to create that change. Now, one of the bad things about scoliosis or abnormal curvature is how the ribs move when a person breathes. It restricts their breathing. And ribs attach on the back and they attach on the front side. So that right there would be more of the concern to come in and go see a chiropractor to address that situation. Now, the Boston or the Milwaukee brace has been shown to not help with dealing with scoliosis, but actually make it worse. So the best thing to do is just not wear a Boston brace or a Milwaukee and just do things like yoga, chiropractic adjustment, do anything it takes to get movement in the spine. It can be changed. There's a lot of change that takes place from chiropractic care when it comes to abnormally curved spines. Now, the reason why I'm not saying scoliosis is because we don't treat scoliosis. We don't treat medical conditions. Medical doctors treat medical conditions. Chiropractors treat bones and joints. And that's what we do. We help a lot of people who have abnormal curved spines. Now, some people would ask, does it hurt? Does chiropractic hurt? How safe is it? Well, that all depends on how inflamed the joint is. Majority of people love chiropractic adjustments. It feels good. It can be addictive. That's why a lot of people come in, they get themselves adjusted, they feel better, they feel sleepy, they feel light, they feel loose, and they go about their day happy. And those who have scoliosis or abnormal curved spines love getting their spine adjusted. They love chiropractic care. It is one of the most positive recommendations that you can do for yourself is get yourself adjusted. Go see a chiropractor and get your bones or your joints moving right. Now, if you know anybody who has abnormally curved spines, go check a chiropractor, see what they can do for you. Okay? Now, the next subject that I'm going to be covering is frozen shoulder. So when at the very end of all the topics, I'm going to leave a time open for anybody or open house subject to talk about any conditions. Okay? So once we finish all 5 most common conditions that are treated in chiropractic office, I will leave the floor open for anybody. Okay? So for now, let's go to frozen shoulder. All right. Now, what is a frozen shoulder? It's not a shoulder that has become like ice. What it means is the joint is not moving properly. It is stuck. The shoulders. So when a person goes right there, they can't move forward. So what is this? Okay. This one, I think, by far is the most common thing that I see in the clinic. Frozen shoulder. The other word for frozen shoulder is adhesive capsulitis. What that means is, right here in the joint, there's a sac called the bursa sac. The bursa sac secretes like a lubrication. This lubrication is what allows the joints to properly move and glide easily so that there is no problems with moving your shoulder, okay? How does this happen? This right here, the biggest cause of frozen shoulder is poor posture. Poor posture and neck issues. There are occasions where someone's had an injury to the shoulder and the same thing happens. So those do happen. But the main one, how you doing, me? The most common thing is when the muscles become so tight, they restrict the motion of the joint and it limits the mobility. And that usually comes from slouching. When you're slouching, your shoulder gets pulled in, goes into flexion because the pec muscles or the chest muscles get so tight, they pull your shoulder in. And then that right there limits how you go. So the answer is to bring it back, and then you're able to do more. So chiropractors help in so many ways in the dysfunction of the shoulder. Now, the downside to having an adhesive or frozen shoulder is it's painful. No matter how you move, there is no other way that you can get your shoulder better without breaking through the pain threshold. That means movement. People who have frozen shoulder don't want to move their arms. They don't want to move it at all. No motion is the worst thing that you can do. Doing nothing is the worst thing that you can do for your shoulder. So it's imperative or important that you just move it. You go see your chiropractor. You get adjusted. You get the joint moving. You use cold compression. You reduce the inflammation. And you keep moving it. And then that's how you get things better. Now, just dealing with the shoulder is not going to correct frozen shoulder. You also have to deal with the cervical spine, your neck. A lot of times people don't realize that, a stiff neck is a problem that will lead towards frozen shoulder. A lot of people don't realize that their headache is because of the neck, which is comprised that goes towards frozen shoulder. I mean, everything, it's crazy how everything is connected. Everything is connected. If you have a low back pain, it can be because of the neck. You gotta correct the low back, you gotta correct the neck. Again, chiropractic is essential to dealing with all these problems, especially when it comes to frozen shoulder. Finding the pattern is very important. That pattern is what separates from you to getting better and not getting better. Now, on a side note, separate from all of these conditions is if you're not consistent with your chiropractic treatment, your problem can come back. That right there is called a vicious cycle. I'm going to talk about something that's very, very important. It's a picture right behind me. It is very, very vital that you understand that if you have any conditions whatsoever, whatever it is, stay consistent with your chiropractic care. Don't let too much space in between go from you going to see getting adjusted and then doing your daily things. So right here, we have a picture. I'm going to take this. That's on the wall. Anyways, right here is called the road to recovery. Okay? Right here represents time. This little line right here at the very bottom represents time. Right here, this represents the healing process. Right here, we see different lines, all right here. This top one right here represents mild, middle is moderate, lower is severe. The more severe a case is, the more often a person must get adjusted, must get treated, must get motion into the joints. It doesn't take too long for the symptoms to go away. It's all the same amount of time. It just depends on the amount of adjustments that a person needs. So if a person is more severe, they have to go see a chiropractor more often than someone who is not so severe, like their mild condition. It takes weeks, let me repeat that, weeks before the symptoms begin to go away. Not months, not years, weeks. But once the symptoms go away, is the condition done? No, that's not how it's going on. The body has to consistently heal itself to stabilize the joint, optimize everything, increase blood flow to the area, change the structures before it is stabilized. Okay? Once the symptoms are gone, that's the most important time it is to get adjusted. Maintain, maintain, maintain as the structures change. So this right here applies to any condition that is being dealt with that a person may have. Now, back to frozen shoulder. Frozen shoulder takes time to, one, retrain the muscles, reduce the inflammation, and allow that dorsal sac to secrete or let out the lubrication. The patients that I see who have frozen shoulder in the beginning have hard times. Because why? It's painful. It is a very painful condition. But once you break past that pain barrier, it becomes easier. And again, this leads towards poor posture. If you maintain good posture, things get better. If you constantly slouch and you have bad sleeping habits, it's going to keep reversing. So you have to change all of these things. Change whether it be an environment or it can be, the stress. It's really important to correct all of these things. I know I'm going to sound like a broken record. I'm going to keep repeating over and over and over until it is understood that you have to basically watch what you're doing. Don't overdo things. Do things within moderation. Do things to reduce the amount of stress that you have, because you can't get away from stress. And that is the biggest cause of why chiropractic care is not just for when you have symptoms. It's a lifestyle. Why would anybody want to get away from chiropractic adjustments? We all need chiropractic adjustments. Chiropractors need chiropractic adjustments. It does not matter. We need it. It's so important, especially athletes. I'm kind of getting away from the whole subject of frozen shoulder, but yes, everything can be helped in certain ways. Now, the last one that I'm going to be going over is slip disc. Slip disc is a misnomer. It is a name that is given that is not true. Discs do not slip. They bulge, they herniate, or they prolapse, meaning they or sequester, they break up. So you have disc bulge, disc protrusion, and sequester. That means complete explosion of the disc where there is no more disc. Now, depending on how bad it is, will depend on how long or if chiropractic can help. Now, if there's one thing that I have to explain that's very, very important. Discs are like a balloon. I don't have a ball right here. So if you get a balloon or a ball and you put pressure above and you put pressure below, the ball will expand out. That right there is how you attack something like that. So you have to figure out what is causing the problem above and what is causing it below. So when you go to a chiropractor, when you have a slip disc, they're going to be looking at your spine as a whole. So a lot of people, I hear people say, well, I have low back pain. Why are you adjusting my neck? Why are you adjusting my mid-back when my problem is my low back? I'm having numbness, I'm having tingling, I'm having lightning shoot down my leg. It is because there are causes that lead towards the disc bulging. Now, as time goes by, those discs that are in between begin to tear away and get less and less and less to the point where it herniates. That is where the inside begins to go out and it puts pressure on the nerves. that right there leads towards knot-like, numbness, tingling, all those things your person feels shooting down their leg. Some people call it sciatica, some people call it restless leg syndrome, so many different things. Chiropractors tend to see a lot of people who come in and say they have slipped disc. Now, again, I'm going to keep saying what I say. Chiropractors do not treat medical conditions. Now, chiropractic helps prevent unnecessary surgeries or injuries through inducing movement into the bones so that the body can heal itself. That right there is very important to understand. There have been times when I would see a patient, they come in and their muscles begin to become smaller or atrophy. That right there is when it is time to send to an orthopedic. And there are times when you don't, but those are the times when I would recommend a person sees an orthopedic, because it's already too late. But 9 times out of 10, a person can be helped. Surgery should always be the last option. Medication should be the last option when it comes to disc issues. It has been shown through research that chiropractic adjustments are very beneficial when it comes to disc issues, when it comes to joint issues. Cold compression is the other thing that is utilized when it comes to low back pain. Now, there's not a whole lot that should be said about slip disc, but other than that is watch posture, watch how you're sitting. You know, don't bend forward improperly when you're picking up something. Prevention is really the answer to everything. You prevent by doing things right. When you prevent, you don't have to have that problem. So the 5 most common things that a chiropractor sees, in my clinic at least: neck pain, low back pain, frozen shoulder, scoliosis, and slip disc. Now, I'm going to leave the forum open for any questions that any of you may have for whatever conditions. Feel free to ask, okay? So I'm going to leave the floor open, and I'm just going to wait for the first question. Once the questions have been finished, then we will end this episode today. All right, let's see. Does anybody have any questions? All right, I'm going to put on some music. So while we wait for the questions to come in. All right. Floor is open. Okay, let's see here. Lights Tontino, can I avail chiropractic adjustment without pre-x-ray test? I went to a chiropractic clinic before and I was informed that it was an absolute requirement. Lights, yes, you can get yourself adjusted. You are not required to get an x-ray. Let's see here. Let's see the rest of the question. If you come to see me over in Alabang, or you go to see any of Doc Rob's chiropractic clinics or other clinics, you're not going to be required to get an x-ray. We can do an exam that will help you get where you need to get to, whether it be reduction of pain by your body healing itself, reduction of inflammation, or any joints that are not moving properly. We'll get motion induced into those joints so that they can move right and so your body can heal right. Chiropractic is not about getting you to instantly feel better, but to get you to heal right. That is very important. All right, I will message you later on. All right, can you explain that pic about autonomic nervous system? Okay, all right, sure, no problem. I will explain what this right here means. So right here, you have the autonomic nervous system. Right here is the brain, and then you have the spinal cord, which goes all the way down right here. It is surrounded and protected by the spine. Now, the autonomic nervous system, what that means is that the nerves are going to organs that basically you are not in control of. For example, like the heart. The heart is constantly going to beat by itself without the need of you thinking heartbeat, beat heart, like, you know, or digest food, or break down the food in your stomach. You're not in control of these organs. So the autonomic nervous system is directly connected to it, and it regulates that. So whenever you have a misalignment that takes place in the spine, it affects how information is going out to that organ and how the organ is communicating to the central nervous system. So whenever a person, say for example, has increased stomach acid, we know, okay, what part of the nervous system connects to the stomach? We know that that is T6. T6 innervates the stomach. If a person is having, say, asthma, we know that T1 and T2 innervate the lungs. So if it's the problem is directly connected to the spine, we find and we locate that misalignment that's causing the dysfunction, and we align the joints, making sure it moves properly, and then the body is able to communicate easier via the central nervous system through the nerves. Hi, Ate Jen, how you doing? All right, let's see here. Another thing that, you know, can be directed is, say for example, constipation. You know, if it's something that is affecting the spine, it can help with that. But if it's not connected to the spine, then that is something completely different. That is the time when we refer a patient to the proper physician so that they can get the right help. Any other questions? What are the exercises for frozen shoulder? Okay. Now, the exercises for frozen shoulder are very unique and different. The main one is just basic ranges of motion, whether it be up, over to side. These are all motions that are restricted when it comes to frozen shoulder. Now, the best thing that can be done is called the pendulum, where you move your arm, you stand over a chair or a table or something like that, and you move your arm in a round motion, counterclockwise, clockwise, up, down, left, right. You're laying right here and you're doing this. These are kind of exercises that help increase motion into the joints. But the thing is, before you're able to do any of that, you got to get the inflammation under control. You need to put yellow or cold compression or ice on your shoulder. I'm going to show you an ice pack so you understand what I'm talking about. Thank you, Ate Jen. Yes. All right. I got this. This right here is what I recommend. Ice bag. This right here, you open up, and you put water on the inside. You don't put too much, you put it in the freezer, and once it becomes frozen, you break it up so that it can fit the shape of your body, whether it be right here, on the back of your neck, and on your low back. And it doesn't even have to interfere with your activities of what you're doing during the day. As long as you put cold compression for, depending on however long. Yes, that's right. It is my favorite because it works. It really, really, really works. This right here has been my best friend. I'm always using cold compression. If I can't get an adjustment and I get a headache or something like that, I put this and this helps me every time. Adjustment is the best part. That's my most favorite. The chiropractic adjustment and then the cold compression. I keep this in my refrigerator above and down below, you know, for whatever reason, whenever friends or family are over and they get an adjustment, I always bring this out. All right. Now the other exercise that I tend to recommend for frozen shoulder is wall crawl, where you crawl up and you crawl down. That is the wall crawl. Okay? Now, exercises for low back pain, for people that have low back pain, for one, is stretching the hamstrings, stretching the paraspinal muscles in the back, right here, okay? Being flexible. A great way to do that is yoga. Yoga is awesome. For scoliosis, it is core stabilizing exercises. For neck pain, there's a little hammock that is utilized. I have it somewhere downstairs. It's sold over at Dr. Rob's clinics. We have the neck hammock that helps with movement and stretching of the neck. So I would always recommend that one too. The neck hammock, and it's a reasonable price. Now, if you have any questions about the prices of this stuff, I can always tell you. It's different depending on where you live at. Any other questions? Oh, slip disc. How can I forget slip disc? Exercises for slip disc, things that are good for slip disc, I would say that would be the lumbosacral brace and lots of cold compression. All right. Does anybody have any more questions? Ate Jen, do you have any questions? All right. What is your address in Alabang? All right. The clinic where I practice in is located in Westgate in Alabang, right next to Jeep, Dodge, Charger, whichever. It's right there in Westgate. You can always find me. We are open Monday, Tuesday, Saturday, and Sunday. Monday and Tuesday, 9 a.m. till 12, and then 2 to 5. Saturday and Sunday, the clinic is open from 9 a.m. till 12 and 1 to 3. So if you have any kind of inquiries, would like to stop by just to say hi, or for whatever reason, that's where I'm going to be at. Yes, you're welcome. Anytime. I'm trying to do this as often as I can. I want to spread the knowledge of chiropractic care, and I want to consistently talk about the most common conditions that we see in the clinic. Alright, so this concludes today's presentation. Hi there! What's going on? So this concludes today's presentation. If any of you ever would like to send a private message to me, feel free to do so. It has been a great pleasure being here talking about all these different conditions. I will post my next 5 most common conditions that is seen in the chiropractic clinic, and I hope to see you guys again next week. Thank you, thank you. Salamat po. Alright, have an awesome day and God bless. Let us all have a wonderful day. Stay cool, stay hydrated, and stay awesome. God bless. Bye-bye.